Doctors afraid their ICUs are about to reach capacity. Patients worried that they're going to die. Those are just some of the concerns inside a South Carolina hospital. NBC News correspondent Ellison Barber got an exclusive look at the Lexington Medical Center's ICU. Here's what patients and doctors there told her.
Right through these doors is the COVID-19 intensive care unit. There are patients behind this door being treated right now. When doctors and nurses first come to work to take care of patients on this floor, the first thing they do is come in this room so they can put on all of the necessary PPE. They are actually storing in these bags some of their face masks that can be reused so they don't risk running out of their protective equipment. This room used to be a family waiting room for visitors. Now it is turned into much needed space where doctors, nurses can take the necessary precautions safely to go inside and treat the rising number of COVID-19 patients.
Hey guys. How are you? Good. I'm sorry, it's crazy today.
Just a month ago, our census was 22 patients on the hospital side that were COVID positive that needed our care, and this morning we were at 64. So we've seen a tripling over the past 30 days.
If you look at the entire hospital and even in our ICU, our numbers have grown exponentially. This is my third intubation of the day, and that's not typical for us. We've actually gone quite a while without having to put anybody on the ventilator, or at least not so many at the same time. Don't come on in.
Hi there, my name's Patty. I'm from X-Ray. And we're going to get a picture of your lungs, okay?
It's been rough. It's painful, and you're scared. You hear all these stories. You're really, and especially at my age, you're scared that something really bad's going to happen. And I want everybody to take it for what it's worth. Anybody can get it, any age, and you just have to be careful.
Has the idea of not making it come into your mind at all? I mean, we hear about so many people dying from this disease. Have you thought about that at all?
Oh, yes. I've thought about it a lot. And it's scary. I've cried many tears.
I thought that that I wasn't gonna make it. So I called all my family and pretty much told them I love them, but I was actually telling them goodbye.
We've had 51 deaths in total. The scary part is over the last 2 weeks, we've had 16 deaths. So of our total deaths, now that we're on week 18, 31% of them have happened in the past 2 weeks.
One of our patients that was the sickest for the longest period of time and had gone through so much. And, I think, he was an otherwise healthy person, young, and still didn't survive this. But then we'll give you more sedation so that you are comfortable.
We are starting to hear increasing concerns from both our staff and our physicians about our ability to continue to meet this current surge that we're seeing, as well as to sustain the level and work of care that's currently happening. It is not an open checkbook. I mean, it is not an unlimited resource that we can keep tapping into. We have only a certain number of beds, a certain number of staff, and a certain number of resources to meet our healthcare needs.
Are you worried that this floor could hit that 18-bed capacity in the next week or so?
I think it might. I think there's a very good chance that our numbers will continue to climb. I don't think we've hit that peak at all. So I think we're going to be seeing increased numbers.
Ellison joins us now from West Columbia, South Carolina. And Ellison, I mean, you look at the gear those doctors are wearing. You listen to what those patients were telling you. I mean, so heartbreaking. What was it like when you stepped inside there and saw a patient being intubated?
It's hard to put exactly into words what it's like. I mean, you hear all of the sounds in that one room, but it's weird because it's a pocket of noise, a pocket of commotion going on. And then you look around and you see all the other rooms with the patients isolated, secluded, because they have to be, where the lights are dim. A lot of them are sedated, not moving. And there's this weird feeling of quiet and also chaos, if you will. I mean, when we came on the floor, we heard and we were told that a patient was about to be intubated. And it was the third one that morning. As we watched it happen, and you just heard, you know, the nurses, the doctors doing so much to try and comfort this person, take care of her, tell them that they were doing everything they could to help her get better. And then you heard all the noises of the machines, the whoosh of the ventilator. And I looked towards the end of the room, and the thing that I kept looking towards were these photos that that woman being intubated had at the foot of her bed, where she could see them probably every day. And they were photos of her family. And you think of just kind of what it must be like to be going through the biggest fight of your life. None of your family can be there with you. And then you look around me, and as hard as they are all trying to care, as much as they all clearly cared, those doctors, those nurses, they're in these suits where they look like Teletubbies. And the thing that you can't stop thinking about is just what that isolation must feel like. And every patient I talked to me said that they can't put into, that I talked to, they said they can't put into words what that isolation felt like. The one man I talked to, I'd asked him, you know, did you think you could get through something like this? What has the isolation been like alone? And he said, if you'd asked me before, I would have said, you know, I could handle something like this by myself. And he said it was unbelievably hard, and there were days where he thought he couldn't. And the only thing that helped him maybe get through were moments of the nurses at this hospital taking extra care to help him. But he said that the isolation that you feel is just indescribable, and to see it in that moment and know somebody was at the worst moment of their life, fighting for their life, and they had no one there. I can't imagine what it would feel like to be that family as well as that person, because you know they wanted to be there too, and they couldn't.
I mean, Allison, you're bringing tears to my eyes just listening to this and watching that video. I mean, this is happening to thousands and thousands of people across our country. I mean, for anyone who does not think that this is serious, who does not think that we need to worry about this, to watch what you just saw there happening to a few people. I mean, it's just absolutely heartbreaking. And I can't imagine what it's like to be a doctor going to work every day, killing yourself so that you could save someone else's life, putting yourself in harm's way, potentially getting sick yourself, and then going home knowing you lost people. It's just, I mean, it's so devastating. What are the doctors there telling you about the overwhelming number of patients that they're seeing, about the help that they need? I can't imagine how, I don't want to say frustrated, but how overwhelmed and exhausted they must be.
I mean, look, these doctors at this hospital, they are frustrated. Almost every single doctor I spoke to said we need a state or even a federal mask ordinance. They said that is the only thing that the community can do right now to help make this situation better, to help someone's mom, to help your neighbor. We hear it so much, but they said that is the only thing you can do if you're outside of this hospital is to wear a mask. And they feel like people aren't taking the initiative as a country, that Americans aren't taking the initiative and making the decision to wear their mask on their own. And because of that, I mean, the CEO of this hospital, he told me it makes him sad that as Americans, we can't just decide to do this to help each other. And in his words, he said that a public health crisis has become some sort of political debate. And he said because it has, there needs to be more action at a state level, even at a federal level, to make people realize that they have to do this to help themselves, to help each other. The other thing they said is testing. They say they do not have enough tests here, and they said that that comes from a federal level. They don't have enough reagents to give people the test. At this hospital, unless you have symptoms, very clear symptoms, they can't test you. That one man we spoke to, London Kennard, he told me that he got tested after he had a lot of symptoms. He did not get his results back for 5 days. By the time he got them back, he said he could barely stand up and walk to the bathroom, and that every single breath he took felt like it was his last. So they need help here. They need more tests here. Across the country, doctors are saying, hey, we still need more tests. The thing people said here so much was, if you look at the numbers, because I asked them about this, I said, you know, some people will see the numbers in South Carolina and say that's not nearly as high as what it is in New York, or maybe numbers that we've seen overseas. But one of the doctors I asked about that, they said there's not a comparison because it's all relative, right? And you have to look at the percentage. They have 20+% of their test in this state, COVID test, coming back positive. They tested over 500,000 people, and 20+% of those are positive. You know, they said it doesn't matter, this big scale number, it's relative. They don't have the capacity to keep dealing with these numbers and also help people who have had heart attacks, who have had strokes. And at the end of the day, 1, 2, 3, 4 people, it's too many. It's someone's mom, it's someone's dad, it's someone's grandparent. All these people here, they all have families. And the thing they keep saying is the most simple thing that we can do
is wear a mask.
Oh, my God. I mean, Ellison, you said it. Wear it. Wear the damn mask. I don't know what that woman's politics are. I don't know where she's from. I don't know anything about her. But I know she is laying there being intubated with photos of her family around her, a family that is probably heartbroken. You're making me cry. I can't imagine how they feel. Like, enough with the politics. Wear the mask. Let's start saving our fellow Americans. It's got to stop. It's just got to stop. Ellison, thank you so much. In Houston, Texas, hospitals are so crowded that a growing number of COVID patients are waiting in emergency rooms for hours and in some cases days before they can even move to a regular hospital bed. NBC News national investigative reporter Mike Hixenbaugh joins me now. And Mike, there are so many concerns here, but tell us more about those patients in Houston waiting so long just to get a regular hospital bed.
Yeah, that's right. What's happening here in Houston is that, it's the latest sign that hospitals are straining to keep up with the surge in demand for their hospital beds. And so when a patient comes to the ER for anything, typically they are, assessed, stabilized, and then moved to another part of the hospital where they receive specialized treatment, like an ICU or another ward where nurses and doctors have specialized training and background in treating their specific condition. And what's going on in Houston is there just isn't, those beds aren't open, and sometimes they're not open for several hours or days. So across Houston, hundreds of patients are receiving ICU level care or other types of care in the emergency room, in an ER bed. And what physicians told us is this is not optimal. This is suboptimal situation where they're having to bring the equipment and the staff to the patients in the ER rather than move the patient to the spot where they need to be. So the hospitals here are straining to keep up.
Yeah. I mean, this is a problem across Texas, right? I mean, the ICUs are seeing fewer beds each day. How are hospitals dealing with the increase in cases right now? What are they going to do if this doesn't get better?
So the hospitals have already started dialing back the number of what they call elective procedures or non-emergent surgeries that can wait. That way, those ICU beds can be set aside and open for COVID-19 patients. They're also opening sections of hospitals that have been closed or converting beds that have been used for other purposes and calling in nurses from out of state. But as the ER numbers show you, is you can't just flip a switch and have those beds be open. And so although the hospitals in Houston have been saying for weeks that we can surge, we can add hundreds of ICU beds, the reality on the ground is that's taking time. And in the meantime, it's creating this logjam of patients coming in the door. And that backs up into the city's ability to respond to EMS calls. It delays everything.
Mike, earlier this week, we talked about the growing number of people in Houston dying at home because of COVID-19. Are officials and first responders worried that even more people will be afraid to come to the hospital now because of this crowding, because they think they might not be able to get a bed?
They are. And candidly, their message is, look, we are busy. It's going to be different than your normal ER experience, probably. But if you are having chest pains, if you're feeling anything, if you're having a hard time breathing, if you're experiencing symptoms of a stroke, call 911, get to the ER, and they will stabilize you and they will take care of you there. And that way you're not waiting until it's too late. And so that's the message from the hospitals, that they are very concerned that people are going to see this message that the ERs are crowded, it's taking longer to get in. But frankly, the candid message from a hospital executive I spoke to at one of Houston's largest hospital systems was, look, we are going to keep caring for patients. We're going to keep expanding beds. We're going to keep doing everything we can, but there's a limit. And if things don't change, if these cases continue to grow as they have been for weeks, then we're going to be looking at another situation like New York was looking at in March and April, and the hospitals will run out of the ability to add capacity. They're adding capacity now, and it's slow and it's taking time, but at least they're making room for everybody. But there's a limit, and they're afraid that within a few weeks they might hit that.
Yeah, for those of us who are here in New York, we could tell you nobody wants to go in that direction. I think they know that. So let's hope things there start to improve. Mikey, thanks so much for your reporting.
Thanks, Allison.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.